I'd like to introduce a concept that I call perpendicularity. Well, perpendicularity is important in at least two main things in dentistry. First of all, in your taking of radiographs on patients. We'll talk about that in the future. Right now I want to talk about perpendicularity as it relates to curing composites using our light curers. Now, some people think that as long as that blue light makes the mouth look blue, the composite's getting cured. That just isn't true. The farther away the light is from the tooth, in orders of magnitude, the power of light decreases. Also, the light beams that come out of our curing lights come out in many different ways. Rays come out straight, and rays come out different directions, and rays bounce off of other things, making things look like it's light. But really, just because it's a blue light, you are not getting the strength you need to make that composite get cured. Let me show you a diagram right now. This is a poorly drawn tooth that I drew for you today. This is the top of a molar that has an MO box right here. Well, in this box, it's important for us to, of course, place our matrix band right here. And then when the doctor puts the composite in there and begins to fill it up, you have to make sure that you do everything you need to get that light perpendicular to the floor of the box. You just can't put your light beam in here and hope that it's going to get down here, because it's not. They're shooting this direction. Here's a side view. This is the floor of the box, full of composite that the doctor just placed. If your light is coming from this direction, many of the light beams will completely miss the bottom of the box. You need to adjust that light so that the light beams are going straight down to the bottom of that box, or it will not get cured. And if it's not cured, this restoration will fail. There will be lots of decay, and you and I will have to redo this restoration. It's going to cost us both a lot of money. So, important thing is, please make sure your light is perpendicular to the area that we're trying to cure. Let me show you on some models. Notice when I try to cure this composite, I've got the matrix band on there. If I don't ask the patient to open wide and I just lazily put my light in here like this, look at how many rays are blocked by the metal of the matrix band. That means that we're going to have a whole section down here uncured. It is important that the patient open wide so that you can move your light into the position that it needs to be to place it right here. So we'll get a nice perpendicular rays going right into the bottom of this box. Once again, you'll move on a mesial composite, you're going to move your light this direction so that we can get the light rays into the bottom of that box. Now on a distal composite, you won't have to be so aggressive at making the light get tipped up. You might actually want to tip it the other way to get down into the distal part of this box. Again, we're going to move the light so the rays are perpendicular to the bottom of the box. Mesial, distal. Be very thoughtful every time you put the light cure in the mouth. Just because it's blue does not mean we're getting the strength of light we need to cure this properly. Now sometimes on anterior teeth, it's not hard to be perpendicular. It's not hard to miss these teeth. Perpendicular isn't as important on anterior teeth. What's important to remember though is that if you take this nice fresh composite that I just properly placed and then you jam this on top of it, it's going to cure it with a nice circle in the middle of it. And I don't like that a bit. I want you to start your cure a little bit away from the tooth. You cure that for about the full 5 seconds. Now, if you want to stick it right on the tooth, I don't care. That's going to be the best cure possible. The closer you can get the tooth, the better the cure is going to be. But on an anterior tooth, make sure you start curing away first, then move in close after you let it cure for the 5 seconds. Okay? Thank you.